My name is Pamela Getz. This is my husband, Jason. I'm a pharmacist, a marathon runner, and on January 22nd of this year, I had a stroke.
I remember it was early in the day. Pam was sitting at her workstation and she was charting orders.
The first thing I noticed something was wrong with her was when she was coming out of the break room, she dropped a cup of water.
I just played it off to fatigue. Never once did I think it had anything to do with what was ahead of me.
I went over and asked her a question and I noticed that she had her head in her hands. And I said, "Are you okay? Do you have a headache? Is everything all right?"
And all of a sudden she started to grab her head. And she said, I can't concentrate on my orders.
She stood up for whatever reason and lost her balance.
I fell to the ground because my right side had gone numb.
What I observed was Pam sitting on the floor, and she was holding her arm in this type of position, and she just kept shaking it.
And I remember them asking me questions, and I knew the answers, I just couldn't say it, and I didn't know how to say it, so I was getting really anxious.
She was able to put some words together, but she was not able to articulate a full sentence.
I couldn't remember my son's name. I knew what his name was, I knew it was Braden, but I couldn't actually get the words out of my mouth.
I honestly never have seen anyone like having a stroke.
I was thinking, she's young. She just ran a marathon. Could this really be happening?
And so that was probably the most terrifying thing for me.
We called 911. And when they got here, they took her blood pressure and it was extremely elevated.
Time is important for us because a lot of the treatments are time-based. Things like TPA treatments with blood thinners and the clot busters normally have to be started within a certain time limit. For most places, that's under 6 hours. There's other treatments that need to be started within 3 hours of the last time the patient was seen normal.
I know the acronym for stroke is FAST. F meaning facial droop. Pam did not have facial droop.
She did have the A for like arm shaking. Her right arm was shaking.
As a few minutes went by, then she did start to have some difficulty with her speech.
And time was of the essence to get her to the hospital.
So the sooner we get you into a certified stroke center, the sooner we can get those treatments started, you're just increasing your chances of being able to one day talk normally, walk normally.
Arriving at a comprehensive stroke center extremely quickly is absolutely critical. Time is brain.
The emergency crews notify us, so we're expecting the patient.
I think the easiest way to categorize strokes are strokes that involve blockages of vessels in the brain and strokes that involve a leak of the vessel in the brain.
In Pam's case, it showed that she didn't have a bleed. In fact, her CAT scan was completely normal, which indicated that she had a clogged artery.
They came in and said, you have a clot in your left side of your brain, you've had a stroke, and we need to initiate stroke protocol.
We access that artery, we feed instruments into the arterial system, all under live X-ray guidance, and actually get to the clot and either deliver a medicine into the clot or use mechanical devices that can extract the clot or suck the clot out. In Pam's case, we accessed her femoral artery at the top of the hip. Under X-ray guidance, we fed a plastic tube. It's called a penumbra aspiration catheter.
Most patients after stroke, similar to what Pam had, would have had remaining language impairment, which would have interfered with her ability to work and to communicate with others.
I was really worried about her memory as far as what was affected by the stroke.
It really depends on what you're opening up the artery to. If you're opening up the artery to dead brain, that's dead brain. The whole point is to try and open up the artery to brain that's alive, that is threatened.
The sooner we treat the patient, the more brain we save. And every minute, millions of brain cells die when we didn't treat.
Calling 911, that's what we're here for. Call us, let us get you there. We have access to the hospital
Well, if you look at Pam's case, a comprehensive stroke center is certainly able to get into her brain and do procedures to clean that artery out. But it's so much larger than that in terms of what's going on in the emergency room, having imaging capacity to study the stroke, to diagnose it, and to do that quickly. The nursing staff that's involved at all levels, from the emergency room to the interventional suite here, and then critically also in the neuroscience ICU. And a critical component to a comprehensive center is having a dedicated neuroscience ICU.
I feel completely fine now. I think about it every once in a while that, oh yeah, you did have a stroke, you know, but I'm back to, you know, exercising and running. Having the stroke has kind of made me stop and think and realize that I shouldn't worry about the little things. And, you know, I need to take life as it is and not worry about the past. I just have to worry about the future. One thing I think about all the time is the fact of how lucky I am that it happened at work and it happened at the time that it did. Because with a stroke, you know, time is brain, and the faster you get treatment, the better outcomes you have, and I have the best outcome ever.